We are going to continue our discussion on the history of Chinese medicine. In this video, we are going to introduce the development of Tui Na. Tui Na is kind of massage. The Chinese term we call it 按摩 or Tui Na. The initial name for Tui Na is actually 按摩, which means massage. In Chinese medicine, we prefer to use Tui Na when we refer to massage. The reason is because Tui Na, we actually use the theory of Chinese medicine. The use of Tui Na had been long since Zhou Li, in Zhou dynasty. There were some descriptions of Tui Na. For instance, there was one story that Bian Che saved a prince in one of the kingdom using Tui Na. Because that's not a medical book, so it doesn't describe the details how Bian Che performed Tui Na on the patient. But the stories recorded that Bian Che saved the prince's life with Tui Na techniques. And afterwards, in Huangdi Neijing's period, we also have some monograph on Tui Na or on 按摩, which means on massage. But unfortunately, those books were lost. From the beginning until 15th century, the common words for Tui Na is actually 按摩, which means massage. We use massage therapy or therapeutic massage therapy for more than 1,000 years. After the 15th century, the Tui Na, the term, were properly introduced in Chinese medicine, and afterwards we use Tui Na refer to massage. This is actually one type of methods that using the pressure from either your fingers or your hand or your body weight to increase the pressure of certain parts of our body and to result in therapeutic effects. Although the type of treatments does not involve in any herbal medicine or any acupuncture stimulation, but the effects cannot be ignored. In 2017, I went hiking in around Johannesburg, just outside Johannesburg, and on top of the mountain, I met one gentleman. He suffered from heart attack, and at the end, now we knew that he suffered from acute myocardial infarction while hiking on top of the mountain. And at that time, I met that patient, and because it was during hiking, so I didn't prepare needles, and I used Tui Na techniques or massage techniques to save this patient, and for 4 hours waiting for the helicopter to come and pick him up to hospital. And afterwards, when he was sent to the hospital, the doctors realized he got 200% fully blockage of the coronary arteries, and he was saved with Tui Na techniques. So this example, you can see the efficacy of Tui Na. If you use correctly, the efficacy is actually quite good. Tui Na emerged in late 15th century and 16th century and 17th century, emerged between 1573 AD to 1644 AD. I mean the terminology of Tui Na, but the techniques have been used for long, since Zhou dynasty. This is commonly used in people who don't like needles. They prefer non-invasive treatments. They also can be used to maintain health. Tui Na also can be used for emergency. So nowadays, Tui Na in pediatrics is actually quite common. And in the history, we also have many monographs on pediatrics using Tui Na. For instance, 小儿推拿活音全书 小儿 means kids. 推拿 directly the name. 小儿推拿秘诀 means secret. 小儿 still 小儿 means children. So whenever you see 小儿 means children. 幼可保效全书 so mostly in 16th century, 17th century. 小儿推拿幼可推拿秘书幼科 so 幼科 means pediatrics. 小儿 means children. So see, all these are the monographs on pediatrics using 推拿. Nowadays in China, pediatrics massage 推拿 is also quite popular. It is implemented in many hospitals. The theory of 推拿 is actually similar to acupuncture and massage. Apart from the pressure from your hand or your fingers, we actually apply the meridian theory. So through 推拿 techniques, we actually promote the circulation in the meridian, strengthen the qi and blood in the meridian and acupoints. So that's why 推拿 is also effective. 按摩 ANMO, so this is also 推拿. The development of external medicine. External medicine in English, there's no proper translation. The reason is because external medicine in Chinese medicine, we mostly refers to skin issues. This including the diseases on the skin, diseases related to the breast, diseases related to cancer, and also diseases related to anus, and also male's problem, the superficial veins and arteries. So these are all belong to the external medicine. The first book we're going to introduce is Liu Juanzi Gui Yi Fang. This book was compiled around 370 AD to 450 AD. The books introduce a method of distinguish different stages of inflammation and offering more comprehensive, precise approach to mechanical use even today. So he actually recommends that to distinguish the skin inflammation of parts, the initial stage, and then once they have passed or after the final phase, we're going to apply different treatments to the inflammation. And from the name of this book, Liu Juanzi is a person in the history. Gui is actually a ghost. Yi means left. So from the title, it actually says this book was left by a ghost. But obviously this is not true. But why they use the ghost as in the name is because they believe that this book is effective. The methods recorded in this book are effective because even the ghosts can use, and these are the techniques from the ghost. So the contribution for this book is the different stage, distinguish different stage of inflammations and parts. This is also commonly used today when we treat, for example, even for pimples. When we treat pimples, we also use the different stage, before the pulse, during the pulse, or afterwards. You also can distinguish, for example, this image, you can see the pulse, but sometimes you don't see the white part. How do you know it has pulse or not inside? So the the practitioner going to palpate on the affected area. If inside is soft and can be moved, and then this pass. If it's the skin is hard, then it's still in the early stage. So these are all recorded in this book. He also emphasized the differentials of syndromes and tumor. And the treatment for these is both external and internal. External means you're going to apply medicine on top of the skin directly, and internal means you're going to either use acupuncture or take herbal medicine orally. So this is also actually one of the very unique approach in Chinese medicine. We treating external diseases, we treating traumatic diseases with external applications and internal applications. In this book, the author also explains that the treatment for pus on the skin. So for example, when to cut the skin and then to release the pus, you need to wait until the formation of pus. So how do you know? So when you see the skin become thin, and then you can cut the skin out. The author also proposed how to treat the skin inflammation. For example, the pus. The treatment of the pus, when to cut the skin and release the pus, you need to wait until the pus, the formation of the pus before you can cut them off. But how do you know? You can see that's the skin. When the skin becomes thin on top, then you can cut them off and then release the pus. You can promote the healing. So this is also commonly used today. This book was used as a textbook in Japan. 外科精要 compiled in 1363 AD. 外科 is external medicine.《人灾直指方论》 also another books on external medicine. For example, in this book, it clearly describes the cancers. So cancers in traditional Chinese medicine we call rocks, because it's very difficult to treat and also very difficult to be removed. It's similar to the rocks. You still have 外科、政治权、生疾、阳科、心得疾。阳科 mostly refer to inflammations and pus and on the skin.